Hello, everybody. Welcome to Lively Healthcare. The tip of today we are going to discuss is about the infection prevention, and we have health professional nurse Mr. Nawaz Ahmed, and let's get to him. Hello, Mr. Nawaz. Welcome to our channel again.
Thank you very much.
Can you
Appreciate
please
for
put some
inviting me.
highlight on the infection prevention topic of today?
Yeah, sure. So I would say that the basic thing I would start from there is if again it's hand washing, hand sanitizing, hand hygiene, and then mask.
I
So
see.
first step is there.
Okay.
Okay. Anything before you touch anything, just wash your hand
Mm.
and sanitize your hand. Then start from there. If you are going to the public gathering, just wear a mask. So this
Okay.
is the first step. So we need to understand that breaking of infection chain. So we start from some point and then go from there, and then we carry those pathogens.
I see.
So first border is hand hygiene.
Okay.
Hand hygiene, and then mask.
I see.
The other thing is that infection is all around in the community, especially in the elderly population.
Mm-hmm.
So we have to think where we can get infection.
I
We
see.
can get infection from our nose,
I see.
eyes,
Okay.
and skin breakdown.
I see.
Skin breakdown is a big thing.
You mean the rashes, just something like small rashes?
And
I
if
see.
you skin breakdown,
I see.
any wound, any untreated wound, it can be infected.
I see.
So the major part is your skin, especially with I would suggest the elderly population, middle-aged people,
Mm-hmm.
even for all ages.
Mm-hmm.
So research shows that if you moisturize your skin once in a 24 hour,
I see.
so basically you reduce the 50% chances of getting infection.
I see.
This is a big thing,
Okay.
especially in the elderly population. They sometimes do not actually notice because their sensitivity is reduced.
Mm-hmm.
They hit sometime to the table, sometime here there in the clutter in the home or apartment,
Mm-hmm.
and they don't realize that they have break their skin.
I see. Mm-hmm.
So as a caregiver, as a family member, as a caregiver person, you have to be vigilant about the elderly population because they are more
Prone to get infected. I see.
So
see.
this is this is a major thing.
Okay.
And then in the elderly population, they don't feel thirst.
I see.
So they are like a dehydrated sometimes.
Okay.
You need to watch out there.
Mm-hmm.
And if elder person is living with you and he's not complaining anything, but as a normal person or caregiver, you have to be very vigilant.
Okay.
Because they can be dehydrated,
Mm-hmm.
because they don't drink enough water,
yeah.
and
Yeah.
they don't have urge to drink.
I see.
So that's why they don't ask you.
Mm-hmm.
So just keep eye on that. And for the infection prevention,
Mm-hmm.
because with the passage of time,
Mm-hmm.
with your age, your skin became thinner,
I see.
and it's a more chance to break down with a very small hit or
I see.
small fraction.
I see.
Some people has a pressure ulcer sitting long time on the sofa chair, so they can hurt themselves, like
Okay.
break down their coccyx area
Mm-hmm.
and their buttocks. So just keep eye on that. And hydration
I see.
and keeping eye on
Mm-hmm.
the offloading techniques. If somebody is sitting too long on the sofa on the one side,
Mm-hmm.
he has chance to break down his skin.
I see. And one thing is very commonly known, especially in the area where we live, and especially the old population. They do have some pets as a companion. So let's say you got kittens, maybe small dogs living with you.
Yeah.
Do you think they contribute to health infections?
Yeah, there's some severe allergic reaction for some people. Some people living with their whole life, that's fine.
Okay.
But still, some people are allergic to hair and cat's hair or dog hairs. So you have to be very careful if somebody has a allergy reaction, and that is very dangerous. So you should know yourself that what is allergy you have.
I see.
And the other thing is that those animal can be like a hurdle for elderly population, because if they animal like to cuddle, right?
Yep. Yep.
So if elderly person is walking, for example, that's a hurdle for him.
Hmm.
So if he can fall down, and the falling is a very high
I see.
in the
Falling rate of
is a very
elderly
high
people. Yeah.
people,
Mhm.
and the most of them is break their hips,
Oh, I see.
and that is a
I see.
dangerous stuff.
Okay.
So it's very good practice if you keep away from the elderly population, from the animals,
I
I
see.
would say.
Okay.
Yeah.
Yeah. Thank you so much. So we'll be back with the next health tip on the same channel again with the same nurse, Mr. Nawaz Ahmed. Thanks for coming.
No problem, my
Thank
pleasure. And I would say again, at the end, this is your health. You have to take care of your own health and take your health in your own hand.